Hamilton Award, Lifetime Contribution to the Field of Occupational Safety and Health. And to present this year's award, I'd like to introduce Sherry Barron from NIOSH. Sherry.
So it's a great honor and joy to introduce Tish Davis. I'm not going to spend a lot of time describing her many accomplishments. You can read about it in the program, and many of you who are here from Massachusetts know her because of her 30 years working and running the Occupational Health Surveillance Program at the State Health Department in Massachusetts. But I'd like to take a moment just to reflect on how I first met and worked with Tish. I was a 20-year-old student here in Boston. I learned about the workers' health and safety movement from David Wegman, as many others did. And I decided to get involved, so I decided to volunteer for MassCosh. And so I got to MassCosh, and they assigned me to the newsletter committee. And Tish was a graduate student at that time, and she was to be my mentor there. And she was really an amazing mentor. Her passion for workers' health and safety was contagious. She was a patient teacher. She treated everyone with respect, and she was a lot of fun to be around. Since then, Tish has become an energetic and innovative leader. She's initiated research in some of our most compelling issues, like young workers, immigrant workers, exploring causes of underreporting, and we could go on and on and on. I think Tish has been involved in most of the major issues. But we've become great friends and professional collaborators, but most importantly, she continues to be my model and mentor because of her passion, her love for teaching, her respect for everyone, and because, of course, she's a lot of fun to be around. So let's give a big round of applause for our
Oh, you're fine.
Can't start off. So, I'm truly honored to receive this award. And of course, the very first thing I need to say is that the things that have been contributed to me are really the collective effort of the incredible group of people I have worked with at the Health Department over the last 30 years. Lisa Hector, Angela Laramie, Beatrice Vaughn, Michael Fiore, Katie Tempowski, Helen Malvin. It's just been a terrific group of people. And Bob, as I say some of these names, I realize that we don't do a great job of incorporating some of our health department people into this movement. So that's your next assignment after all. Like others, I need to acknowledge David Wegman. There is some justice in the world when your thesis advisor comes to work for you. I also need to recognize MassCosh and the worker centers and other community organizations who are on the front lines. I don't think I could have spent 30 years at the health department if I didn't have these working relationships that never let me forget the reality of working people's lives and giving hope that the kinds of work that we do in the health department can make a difference. So, like others here, I want to reflect a little bit on how I got involved in occupational health. It was 1974, and I was actually working in the environmental movement, the early environmental movement. And I got offered a job to work for an organization that brought labor, civil rights, and environmental groups together. It was really one of the early environmental justice organizations to address issues of common concern. And I don't think it will surprise many in this room that this was one of Tony Mazzocchi's brainchildren. He was on the executive board along with some folks from the UAW, the Steel Workers, and American Public Health Association. So one of the things, I worked on lead paint poisoning prevention in TSCA. Then I got assigned to cover the OSHA hearing on the occupational noise standard. And OSHA was proposing to reduce, to establish a time-weighted average of 95 decibels. So I remember a number of things about this hearing. One was that there was, the real issue was technological feasibility. It was really focused on dampening the noise in the textile mills. And I remember there was a young engineer from a Southern University who was waiting for his turn to testify. This took several days. And the night before he was supposed to testify, he got a call from his dean who said he can't testify because the textile industry is the biggest donor to our university. So that's part of the story. And then the other piece I remember is the unions brought in a tape recording and played 105 decibels in this hearing room. You can imagine if anyone's ever heard 105 decibels. And I really clearly remember this is Tony Mazzocchi leaning over and saying to me, if you listen to this for all day, you'd stop for a drink on the way home too. And that's a really important public health message. The last part of this story is this was a really formal proceeding, and there was a corporate lawyer named Lorin Kerr and Eric Fruman, who's a health and safety activist with textile workers at the time. He had organized bringing in a bunch of women from the mills. One was a business agent. And this lawyer, again, it had been doctor this and doctor that, so very formal hearing. And then Lorin Kerr gets up and he says, he's cross-examining them, and he's saying, he said, "Now, Alice." So everyone was, so condescending. And so 2 weeks later, Lorin Kerr was on the stand, and Eric Fruman got up and he started off, and he said, "Now, Lorin," the whole house. So I've been doing occupational health ever since. And when you study work, you realize what a privilege it is to really be able to make a living doing what you believe in, and to have such an incredible network of colleagues. Many have become some of my closest friends. So I really, those of you who know me know that I'm seldom at a loss for words, but I really struggled with what I should say today. And, so I thought, since I do surveillance, I need to talk about the importance of data for action, and really about the importance of using public health data sources to tell the story about worker health that our employer-based statistics are never going to tell. And yesterday, we actually, I don't know if anyone read the Boston Globe, but there was an article based on some of the work done by Pat Fitzsimmons in our program, that the second line in the article was low-wage workers receive less protection. This happened to be about environmental tobacco smoke. We were able to tell that story because we got NIOSH is funding us to collect occupation in our health survey. Other countries have worker surveys. We don't have worker surveys, so we need to piggyback data collection on our health surveys, and we've been able to do that in Massachusetts. This is a pilot project. We need to keep that variable that is in that data system, and we need to get occupation in electronic health records. So the other thing I thought about is, well, maybe I should talk about what it's been like to document every work-related traumatic injury in the state of Massachusetts since 1987, and how you never, ever get used to it. Each incident is a tragedy, and in each incident, never fails to remind me that we are all connected, we all depend on each other's labor, and we are all diminished by these deaths. So I'll share. I have told so many things I want to talk about. Now, surveillance, by definition, is linked to intervention. It carries with it an imperative for action. No one's interested in data for data's sake. And so it's really important. I want to talk about the opportunities, and Tom talked about some of these earlier, while we continue to pressure for OSHA standards, is looking for local campaigns and local issues and using other avenues to make a difference. We've been successful using some of the shared hazards where public and workers are exposed to common hazards like indoor air, cleaning agents, latex. We've really been successful in really advancing the agenda. We need to look for more of those opportunities. I think the issue of patient and worker safety has really been recognized. We have reports now from JACO and from the Joint Commission and from the Pollution Legal Institute saying that worker safety and patient safety are inextricably linked, and we really need to build on that to move forward to protect workers as well as patients. You know, the last thing that I really want to talk about is, you know, I was alluded to in the session by Linda Murray, and I wish I could channel her, about, you know, really the vision that we had in the 1970s is an industrial model, and with the changing nature of work, the changing nature of work relationships, the rolling, all the reasons you know about here, it's too limited. And we really need to think more broadly about work and health. We need to define, I think this was Linda's quote, our issues in other people's issues, but that means that we need to define other people's issues as ours. I've learned that in public health. I also, I'm looking at Sherry, I also think that if we're going to meet the needs of our most vulnerable workers, these are the same workers who confront health inequities on a number of fronts. They have hazards in their communities as well as in their workplaces. If we're going to address their needs, we need to build bridges across public health disciplines to like innovative partnerships to really address the interaction between work and non-work factors. You know, our health programs may be solid, but the lives of workers are not. The last thing I want to say, this was really an unexpected advantage of receiving this award, is that a real highlight of my week has been able to introduce my daughter Caitlin to the occupational health community. Caitlin is living in Brazil working on issues of gender justice. And the slogan of her organization, which I really suggest as the slogan for our 100th anniversary next year, is not research to practice, it's research to justice. Needless to say, I'm proud of her, but this week I also feel so proud of this community. I'm proud of the old-timers who have remained steadfast in their commitment to protect worker health and dignity, and the new generation that have come along to join this struggle. Thank you.